Lymphatic 8, we did the lymphatic 7, which was the neck. So this will be focusing on the hip flexors, which are known as the psoas. And so it's a low back issue. And we basically are just going through and looking at it, not so much from a point of view of a symptom-oriented approach. We do treat symptoms, but we also look at what are the contributing factors to the psoas being wound up. And so when the psoas is wound up, it can throw off your breathing, it can throw off digestive function, it can throw off lymphatic function, it can cause urinary and bladder issues, can throw off women's cycle. And for men, it can cause pain down into the testicles and throw off part of their function in that area. And then it can be also very painful, like radiating down the leg and then going up and down the spine. Like sometimes if you have back pain, you kind of rub like side to side. That is usually more of the abdominal muscles. When you rub up and down your spine, that is the hip flexor or the psoas. And so there's 3 key muscles that you kind of look at when you're doing osteopathic evaluations, or at least I did back in the day. One is the neck, one is the diaphragm, and one is the hip flexor. And forms of anxiety can come from it. When the hip flexor attaches to the last 5 vertebrae of the spine. So anytime that the body feels unstable, these muscles tighten up and they'll cause, just a super wide range of problems. In osteopathic practices, they refer to the psoas as the hidden prankster, because it just causes all this weird dysfunction in the gut, in the urinary tract, the women's menstrual cycles, like all those things I was saying, plus different pain syndromes. And then it becomes harder and harder to treat. It starts to throw off the way we walk, the gait, can throw the breath off, can throw like anxiety is not exactly the right word, but there's just this weird tension that can be in the body that, like, it's an overstimulation of instinctive responses that gets generated when the psoas is tight. And I would say everybody has a psoas issue, like everybody. Nobody gets away from it. And so we're going to go through, it's just a 1-day free class, but we're going to go through and look at how to go through and unwind it. And we use like Palo Santo, there's different things that we use for this, but our person that works in the office, her partner is not into any of the oils or anything, but he started having some aches and pains, and they were describing it to me, and I kept saying, oh, it's like a psoas issue. And finally they were going to do something about it. So we just did one step out of what we do in the class with like the Palo Santo. And he's like, I don't know anything about these oils, but like, it's amazing. Like, I just sit and inhale these oils and my back's better. I can get up and do stuff. And, he's had like a super chronic back issue for a long period of time. And he's not even putting the oils on. He's just inhaling it. But, have him doing a simple little pattern for it. And he just says, like, if his back starts to flare up, he sits and does it, unwinds it, and moves on. Now, if he'd do the whole thing, he probably wouldn't even need to do the tune-ups very much. But, that pattern's been there for a while. And so all of this, anytime the neck, the diaphragm, or the psoas is off, it completely throws off your lymphatic function. And so This will help to deepen the level of lymphatic function, especially closer to the bone. And it should help with hitting the anabolic state, which is a state of recovery that happens while you sleep. So we'll be kind of addressing all of that in the class. And the kit is real simple. We'll list it on Wednesday of the oils that you need for that. But it's pretty straightforward. You probably have most of it in your repertoire. It's like Palo Santo and frankincense, and it's stuff that you use. So it shouldn't be any big thing that you need.